Hi guys, how are you all? Today we are going to see about the psychology of the vulnerable individuals and groups from subtopic from developmental psychology. First of all, who are these vulnerable individuals? Mainly, there are three main peoples who comes under this vulnerable group. Women, the people who are visually or challenged individuals, and the sick persons comes into this vulnerable group. Mainly three aspects comes under this vulnerable: women, challenged individuals, and the sick person. Coming to the psychology of the challenged individuals. Here, first of all, they will have the complete reorganization of relationships. Whatever they are having the chronic illness or prolonged illness, they have a reconstruction of patient idea of himself. So there is a complete reorganization of relationship. Then coming to the second one, they will be angry with himself and others. If they are born with the challenged things, they will be angry all the time and anger towards the family. Due to this physically handicapped or any challenged thing, the person will get affected with the anger towards the family, and he won't be able to move with them freely. Then refuse to meet the people. The person who are vulnerable, they may refuse to go out. Then self-consciousness aggravates. Here in this phase, the difficulty for the family members and the hospital staff will be more. Then depressed. All the time by thinking regarding that challenged individual, the person may get depressed, loses interest. Sometimes if we want to perform some task or achieve some goal, by the peer experiences or peer deprivation, they may lose interest. Insufficient nourishment. Due to the depression, he won't take the sufficient nourishment useful to the community. Whatever the will to recover, the nurse must help the patient that what he is needed by those who love him, and that he can be useful to the community. Coming to the next one, optimistic. Here, the patient may feel obligated to pretend that he feels optimistic in order not to cause any pain in his relatives. Coming to the next one, achieving the excellence. Here, they concentrate more on achieving the excellence in order to reach their goal. Coming to the last one, interpretation of environment. Here, what happens, whatever the surrounding areas aggravates him, whatever the surrounding areas aggravates him in a positive way or negative way, the surroundings must be well supportive. So, nurse needs to interpret the environmental area. Coming to the psychological needs of women. There will be assertiveness, body image, depression, teen pregnancy, infertility, domestic violence, and the rape. Coming to the assertiveness, many women have been raised to passive and place the needs of others. So, here what nurse can do, here the nurse can help the woman to bring out her strength and work towards the understanding their needs and the goals. Coming to the body image, here some women may think their body with fear and sometimes leading to the self-injury. So, they need to have the proper support. Coming to the next one, depression. Here, women are twice likely as a man to face the depression. For example, hormones plays a major role to create the mood changes. In case of menstruation and all, the women get easily depressed due to the hormonal changes. Coming to the next one, teen pregnancy. Here what happens, if an unwanted pregnancy occurs, then the emotional development will be altered easily. So in this case, nurse need to understand their feelings and bring out their own strengths in order to cope up with that situation. Coming to the infertility, here in case of infertility, the woman will be financially, emotionally and psychologically, the women get easily depressed. So women often feels that the loss of not becoming pregnant or psychological loss of not being a real woman. They will think that I am not a real woman, like that, for that I am not going to be a pregnant, like that they will go on think continuously and they will get deprived. And finally, after the infertility, domestic violence. Coming to the domestic violence, here the emotional abuse is difficult to identify. Early age we can't able to identify, because the abuser, what he will do, he will degrades her dignity and self-worth, that he will make that she is worthless, like that he makes that person. Coming to the final one, rape. Here whoever the woman who was the victim of the rape by a stranger or family member often experience the psychological effect, that is known as a rape trauma syndrome. Here what the woman experiences, the woman faces the low self-esteem and low level of confidence. Their confidence levels will grows down, and the common feelings also occurs that include the depression and the anger. These are all the psychological needs of the woman. Coming to the next one, psychological needs of sick person. These are the main changes whatever we observe in the sick person. Emotional changes. Already if the patient is sick, again due to this psychological illness, the sad behavior, he continuously think regarding their disease condition and he will get deprived. For example, if we take into consideration regarding a cancer patient, due to the illness, he will be already on treatment. Again, due to that cancer symptoms and all, he will get deprived more. Life-threatening illness. If the illness is chronic and it won't be get reduced with the treatment, the client continues to think about that. So we need to identify the person who is thinking about this life-threatening illness, and we need to explain them clearly how that get reduced. Excess workload. Here, excess workload in the sense, there may be anger about the excess workload or a dangerous lifestyle which is responsible for the illness. Coming to the communication problems in the sense, if the patient and family members rises, if we are well informed about the health issue to them but they didn't understand properly, there will be communication problems. So we need to repeatedly contact them and explain them clearly how to get rid of the disease. Then update of current events. Here the patients need to be stimulated by giving the updating of the current events. So visitors also encouraged to share the news rather than asking for it. Then coming to the maintain family relationships. The nurses need to maintain the family relationships and friendships during the illness if the patients are small children. Coming to the next one, anxiety. If for example, if we take consideration into some child, if we'll keep them separately from the parents, the child will be more anxious. So soon after the treatment, we need to explain them that we are going to provide your parents to spend with you, like that we need to explain them clearly so that they can easily participate in the treatment. Coming to the next one, greater independence. Here what happens during the illness, if the patient remains at home, they will feel the greater independence. So the nurse's job will be here more challenging. We need to attend the skills perfectly. Final one, burden. Due to the prolonged illness or life-threatening illness, the patient may feel the burden. So in order to reduce that burden, we need to give the psychological support to the patient so that they can recover easily. Then during the illness, there will be sometimes loss and grief. Mainly this grief is subdivided into 5 stages: denial, anger, bargaining, depression and acceptance. Coming to the denial, here what we'll think, this can't be happening to me. We'll continuously think why it happens to me always. Like that, in a depressed mood, we used to think continuously. Coming to the next stage, anger. In this stage, we'll think why is this happening? Who is to blame? Like that, we will think why it happened to me. Now, whom I can blame? Like that, we will think. Coming to the bargaining, make this not happen and in return I will. Like that we will think continuously. Then fourth stage of grief, depression. Here I am too sad to do anything. Here what we will think, I can't able to do anything, I am too sad. Like that in a depressed mood we will be. And final stage, acceptance. Here in all these stages, whatever happened, we will think at a time and finally we accept that thing. I am at peace with what happened. Whatever happened, let them happen. Now I will be in a calm mood and mind. Like that we will think finally. That these are all the stages of grief. And at last, mourning. Mourning in the sense when suddenly some death occurs, then the death patient, attenders or relatives, whatever we call, they will be in a deprived mode. Sometimes they won't be accepted that situation, how suddenly it happened. Like that they will be in a depressed mood. So in that case, nurse need to understand their feelings and she need to explain them clearly regarding their illness and what is the future outcome. Otherwise the attenders feel guilty and they will develop the physical and psychological problems. Thus we need to understand them and explain them clearly so they will come out from that situation. With this, today we had completed the psychology of vulnerable individuals and groups in the developmental psychology. Thank you one and all.